45 more minutes, you can do that, and it doubles. It doubles. You can do 50, turns into 100.
This is Dave Seeley on my right. Dave's 56. He's from Rockland, and he's the patient. And this is Dr. Tony Shueri, an oncologist at the Dana-Farber Institute. Dave, I see that just before Christmas in 2008, you got a present that you didn't really want.
Yeah.
Tell us your story.
Right. Well, it was a tough time. It was just before Christmas. I was feeling great, and then all of a sudden I wasn't. Didn't understand what the problem was. Spent 12 hours in the emergency room before they finally said, well, we got to send you in town to find out what the real problem is. We think we know what it is, but we need the specialist to look at you.
Did they tell you what they thought it was?
Yeah, they told me that it looked like it was cancer on my kidney, but it was more than they could handle. So my story started from there with Dana-Farber, and it's turned out to be a great story, and that's much more than I expected.
You were diagnosed with clear cell renal cancer.
Yeah, that's right.
What does that mean, doctor?
So that's a form of kidney cancer that is, in fact, the most common form of kidney cancer. It's an aggressive form, and in general, the chances of cure when the cancer leaves the body, leaves the kidney, in fact, like what happened with David, is very, very small. I remember David. I remember the day David came to me with this diagnosis, and it wasn't really an easy consultation. David was handling a lot. It wasn't only a clear cell renal cell carcinoma. It was a metastatic disease that went to several organs, and he had some adverse risk features, particularly of that disease, that make it overall poor risk. Something else that David didn't mention, he was feeling great. He was working very hard, and at the same time, his son, in fact, was in Afghanistan defending, our country.
Right.
And this was not an easy thing. That's the last thing he needed, especially around Christmas. So we had a long conversation with David, and I told him, look, this is the treatment, the standard treatment we do. It's a pill. But at the same time, David, beside, in fact, the cancer, this is an aggressive cancer, and we do have a clinical trial. You're a healthy young man. Let us try, as part of a clinical trial, to combine this pill with another drug, hopefully to kill more cells and prolong survival. So we started that. That was several years ago. David had a wonderful, wonderful response, and he's been off the clinical trial. He finished all those cycles. He's been now 2 years, David, doing well. The scans look great.
Doing great.
And he wants to go back to work, maybe.
So when he came to you, he was very, very ill.
Correct.
And you decided to do the clinical trial as opposed to just the one pill because you knew you were that ill?
No, because I was in a place where I knew they knew the best, and if they recommended this, that's what I was going to go with.
Good move.
I knew going to Dana-Farber that I was in the best care I could get, and luckily for me, it had the best possible response. So I got good advice and then got a good outcome. So
What causes renal cancer, doctor?
Well, in general, there are some risk factors associated with kidney cancer, such as smoking, weight, obesity, and others. However, the association overall is very, very loose. This is not an association like with lung cancer, where smoking is very linked. This is a loose association. Most of the time, especially with the fact that kidney cancer still does not have a screening test like breast cancer, prostate cancer, and others. Most of the time we really sometimes detect it, later, and we do not know what is the main thing that causes it. Yeah.
When you put your head on the pillow at night, David, did you worry more about you or your son?
Oh, I worried more about my family.
Your son was in harm's way for how long? Or he's still there, right?
He's in Kuwait now, right?
Actually, he's in Kuwait.
Yeah.
He was there for. He was only there for 8 months, but it was a long 8 months for us, that's for sure. And we didn't want to discuss with him what my condition was. I mean, that's it just didn't seem the thing to do, but it also didn't seem the thing to try to hide it from him either. But so we just told him about it and downplayed it.
Jerry asked this question of somebody earlier, and I think it's an appropriate one to ask you because you've had such a successful treatment. Do you feel like a lucky guy or an unlucky guy?
Oh, I'm as lucky as I can be.
Even though you got this in the first place?
Yeah, that was a bad roll of the dice, but I'm a pretty lucky guy.
Did you have many weeks or days or months of the why me thing at the beginning? Was there much of that?
Yeah, I guess I can't say that there was, but I can't say there wasn't either, because there were times when, I just find myself in a pretty funky mood. For the most part, I knew that I had a lot of support. I had great doctors. I had family that was, just there all the time. So I knew I was lucky.
What were the side effects of the treatment?
Feel pretty lousy a lot.
Like flu-like kind of feeling, or nausea, or headaches?
Nausea. Don't want to eat. Like to sleep but can't sleep. Just really feeling like you got the flu. I guess would be a close description. Just not feeling good a lot. A lot of aches and pains.
How does life change when you lose a kidney? Does it?
Well, patients in general, have another kidney, so they can.
I knew that, doctor. I'm no expert. I knew that.
So they can lead a normal life, but the idea here, again, and that's a great question, is in patients also that have a small kidney cancer that hasn't spread, which is not the case of David. A lot of times we do a partial nephrectomy, and we try to save the rest of the healthy kidney if possible. If technically possible. And I just want to just take a small, 1 minute of your time to thank not just David, but thank all our team, our wonderful research team. I mean, the experience is not just the doctor, our wonderful research nurses that go above and beyond, our wonderful clinical research coordinator, our wonderful admins. I mean, the experience, and I came from Cleveland. This is great. This was my first stop after Cleveland. I'm very proud to be at Dana-Farber Cancer Institute and in Boston. And the experience starts when you park your car, and it finishes also when you leave. So I want to salute all those heroes, our research nurses, our admins, everyone that participate in this great experience for everyone.
I recognize that as a Cleveland accent, didn't you, Jerry?
Yeah, no, and plus he says when you park your car, when the hell can you find a parking space?
No, you have to valet. I said to valet. Yeah, rural Cleveland accent.
Can you talk about the research advances in the treatment of stuff that you're studying, prostate, kidney, and liver cancer? What's happened in the last couple of years? Good,
so,
a lot of stuff, or very slow?
Advancement in prostate cancer and kidney cancer. I can tell you first, for example, let's start by kidney cancer. The case of Dave. We had some form of immunotherapy that worked in few situations and had a major side effect. But since that time, drugs, a lot of it or part of it started from labs at Harvard. Looking at drugs that target the blood vessel that feed the tumor. And now we have several FDA-approved drugs, and we're trying to build on that to go to the next generation drugs, which is drug that counter this resistance that you develop for this new drug, and developing more so a new immunotherapy drugs that work better and have no side effects, no flu-like side effects. And prostate cancer also major advancement, not only with chemotherapy. We have another new chemotherapy, but also with vaccine, with drug that work along the hormonal axis, and with other drugs that work on the bone. So patients now have many more options than before, than when I started, working, and hopefully they will continue to have that. And all these will lead to prolonging the life of the patient with acceptable quality of life.
And it's all fueled by money, is it not? All this research, and that's why we're here.
Well, it's correct. The bottom line, it's all fueled by money, like many things in life.
How do you feel, Dave?
I feel fantastic.
100%? Back to normal?
100%.
Good for you. Now, this is the portion of the show you get to brag on your grandkids. You call them the light of your life.
Yeah, they sure are. My daughter has 2 sons. My son has a son. My daughter's oldest is 2.5. Honestly, I didn't think I'd ever see a grandchild when this diagnosis came out.
That's the best reward of all now, isn't it?
Gosh, yeah.
Tell us about Jimmy Fund Campout. What is that? What are you getting involved with that?
That's coming up.
What is it?
In September. It's a September 14th through the 16th, and it's a family event at campgrounds around New England. I'm going to be at one down in Sandy Pond down in Plymouth, and we're going to be helping with an event that's called Geo-teaming. A lot of fun. Something that everybody should try. It's a great time.
Geo-teaming?
Yep. It's like hiding small little caches, and then you got to go find them, and it's a lot of fun. It's a lot of fun. It's a great thing. And it's family fun, and that's what camping is all about. And Jimmy Fund is sponsoring the weekend, and all the funds go to them, and we're really looking forward to it.
Dave Seeley, congratulations on your prognosis and getting your life back. And Dr. Choueiri, thank you very much for spending some time with us today.
Thank you.
Good to see you.
Thank you.
That's the phone number.